Hey everyone, thanks for joining us for another deep dive. We always get tons of requests to unpack global health and the power dynamics in that world.
Yeah, for sure. It's a big one.
It is a big one, and we've got two really good books to help us do that. Rethinking Global Health by Rochelle A. Burgess and The Foreign Gaze by Seye Abimbola. They both give us some really cool insights into what's working, what's not, and, who's really calling the shots.
It's fascinating stuff. When we talk about global health, it's easy to picture, doctors and nurses in far off places, but rethinking global health really pushes us to see beyond that, the purely medical side of things.
So what does that look like? I mean, moving beyond the medical.
Well, for example, the book talks about philanthropists, like the Gates Foundation and the role they play. You can't really talk about global health without talking about them.
Right, it's huge.
Huge. And then there are the community organizations that are really doing the work on the ground day in and day out.
Oh yeah, absolutely.
And of course, NGOs, which are a whole other layer of complexity, their involvement can be so varied.
Absolutely. So it's really about seeing global health as this kind of interconnected web of different players.
Exactly. And each with their own agendas, their own levels of influence. And honestly, sometimes those agendas clash.
That makes sense. And, it makes me think of that quote from Copeland, and I think it was his colleagues in Rethinking Global Health, where they talk about the need for a two-way flow of knowledge
Oh, yeah, that's a great word.
between, high-income countries, and I'm doing air quotes here, developing countries.
I think what's so important about that idea is, it challenges that traditional top-down approach where the solutions are always imposed from the outside.
Right.
And instead, it really emphasizes building true partnerships based on, mutual respect and learning from each other.
Not about having all the answers, but working together to find solutions that actually fit the context.
Exactly.
Which kind of brings us to the elephant in the room.
Yeah.
We can't talk about global health without talking about money.
Oh, yeah, the economics of it all, right?
And Rethinking Global Health doesn't shy away from that at all.
Not at all. It's very upfront about the fact that, financial resources often equal power, the power to set agendas, the power to decide what gets funded.
It makes you think about those with the most money, like the Gates Foundation. Again, they do so much good. But you have to wonder what happens when so much funding power is in the hands of, one organization.
That's a valid concern, and it's a question a lot of people in the field are grappling with.
For sure. I mean, on one hand, you need those big funders to tackle these global challenges, but how do we make sure that the people who are most affected by these issues, that their voices are heard
Right.
and that their priorities are reflected?
Right. And that's where the concept of structural power comes into play, which Rethinking Global Health draws from Jeremy Schiffman's work.
Okay, fill me in.
So it's the idea that, certain actors, often those who are seen as the experts, right?
Yeah.
They have this power to define what's possible, what's acceptable in the field.
So it's not just about the money. It's about who gets to decide what questions we ask, what solutions we consider, even how we measure success.
Exactly. And understanding those subtle power dynamics is crucial because they can really shape the entire direction of global health efforts.
It makes me think of The Foreign Gaze as well, because it really dives into that question of whose knowledge matters.
Oh, that's such an important book.
It is.
And Abimbola really challenges that dominant perspective, which is often this Western lens that can unintentionally silence other ways of knowing, other forms of knowledge.
It's so powerful. And that anecdote he uses in the introduction of The Foreign Gaze really brings it home. It shows just how vital it is to value and understand how communities see and experience health challenges themselves.
That story really stuck with me too.
Right. It's so easy to assume that one perspective or, one system of knowledge holds all the answers.
Right, and that's so dangerous.
It is.
And Abimbola uses this really fascinating example to illustrate this point. He talks about Mungo Park's discovery of the River Niger, a classic case of how the very concept of discovery can just erase pre-existing knowledge. The people who lived along the Niger River, they knew it was there all along.
Right, exactly. It was only a discovery from a very specific worldview.
One that prioritizes Western exploration and knowledge over local understanding.
It's a good reminder to be cautious about, imposing our own frameworks and definitions on situations we might not fully grasp.
For sure.
And approaching global health with humility and a real willingness to learn from those who are most affected by the issues.
Absolutely. And sometimes that learning involves unlearning unlearning what we thought we knew and being open to new ways of seeing the world.
Okay, so we've established that global health is way more complex than it might seem at first glance.
Yeah.
We've got these intricate networks of people and organizations, power dynamics tied to money, different ways of knowing and understanding health challenges. What happens when we try to put all of this into practice? When we look at actual interventions and solutions.
Oh, well, that's where it gets even trickier. And that's something both books really delve into in their own ways. In The Foreign Gaze, Abimbola talks about surgical versus organic change. And he makes this case that there's this real allure of those quick fixes, those surgical interventions that seem so neat and tidy from a distance.
Like the magic bullet solution.
Exactly. But Abimbola cautions against that approach. He argues that these surgical solutions often overlook the messy realities on the ground, and real lasting change, he says, is more organic. It grows from within communities, from a deep understanding of the context, the interconnectedness of the issues.
So it's not about imposing solutions, but about nurturing the conditions for change to happen from within. And that makes me think of the example in Evidence is Cliché with transportation vouchers.
Oh, yes, that's a perfect example.
This idea of providing vouchers to help people access healthcare.
Right, seems like a simple solution.
It does. But if you don't address the underlying reasons why people can't access care in the first place, like poverty, lack of infrastructure, those vouchers are just a Band-Aid.
Exactly, a temporary fix.
It highlights the importance of taking a step back and looking at the systemic issues at play rather than jumping to those quick fix solutions.
Absolutely. We need to be asking, how can we support those organic change processes, the ones that lead to sustainable and equitable outcomes?
And those are the outcomes that really matter in the long run.
Absolutely. It's a crucial shift in thinking, and it requires a willingness to embrace the complexity, to move away from the allure of simple, externally imposed solutions.
So if we're moving away from surgical fixes, what does a more organic approach to changing global health actually look like?
That's a question we'll dive into even deeper as we keep exploring these books and their insights. But one key theme that keeps coming up is the need for decentralization.
Okay.
Shifting power away from those centralized authorities and towards those who are working at the community level.
Makes sense. If we're talking about empowering communities, then decentralization has to be a part of it.
Exactly. And that's where we'll pick up in the next part of our deep dive. We'll explore what decentralization looks like in practice, the challenges it brings, and how it can really contribute to a more just and equitable global health landscape.
Yeah.
We were talking about shifting those power dynamics, right, and really embracing those organic approaches to change.
Yeah.
Well, Evidence as Cliché dives into this really interesting example that highlights all of this, and it's performance-based financing in healthcare.
Oh, okay. Yeah, I've heard of that. But
Yeah.
to be honest, I don't really know much about it beyond like the basics, linking funding to performance targets.
Right. And on the surface, it makes sense, right?
There you could
Improve performance, you get more funding. But the book argues that the system kind of masks this need for deeper, more fundamental change, like decentralization.
So how does performance-based financing connect to decentralization or the lack of it?
So Evidence as Cliché critiques this framework that a lot of people use to understand health systems called the triangle of persons.
Okay.
And it focuses on those relationships between policymakers, healthcare providers, and the people who need care.
Right.
But the problem is this model, it's way too simplistic, especially when we're talking about global health and the complexities of governance in those contexts.
So it sounds like if you only focus on those 3 points of the triangle,
Yeah.
you're missing a lot of how power actually flows within the system.
Exactly. And to get a more nuanced understanding, the book introduces another framework, the triangle of rules.
Okay.
And this one looks at how those formal and informal rules interact at different levels of governance.
So instead of just looking at the individuals, we also need to consider, the rules, both the written and unwritten ones, that shape how those individuals operate within the system.
Exactly. It's about recognizing those structures that often go unseen, but they're the ones dictating who has the power to make decisions to allocate resources, ultimately decide how health interventions happen.
Which brings us back to that concept of structural power.
Wow,
right?
and absolutely.
It's like those underlying forces that can really block real lasting change, even when you have well-intentioned people trying to make a difference.
Exactly. And that's why just focusing on performance metrics like performance-based financing often can give you this illusion of progress without actually addressing those power imbalances that prevent communities from truly owning their health outcomes.
It's like putting a brand new engine in a car, but the steering wheel's broken. It might look like an improvement, but you can't control where you're going.
That's a perfect analogy. It's about understanding that real progress in global health, it requires more than just hitting targets. It's a fundamental power shift, a willingness to trust and empower those who are closest to the issues.
And this leads to another crucial point that both books highlight, this danger of ignoring local knowledge, those perspectives of the people who are most affected by these global health initiatives. To be wronged as a knower really hit me with that anecdote at the beginning.
It's so powerful the way it shows how easy it is to overlook or even dismiss the lived experiences and the expertise that communities have.
It's a reminder that even research, which we often think of as objective and neutral, it can be shaped by power dynamics and assumptions
For sure.
that can end up silencing certain voices.
Absolutely. To be wronged as a knower uses this example of research on group antenatal care in Nigeria
Okay.
to show how even researchers with the best intentions can miss really important insights if they don't understand or value the local context.
So can you explain that a little more?
Yeah, so the book talks about how researchers might focus on those individual health indicators and totally miss the social support and community building aspects that are central to group antenatal care in that context.
So it's like you're looking through a keyhole, you can see some things clearly,
Yeah.
but you're missing that wider view, the context that gives meaning to what you're seeing.
Exactly. And that's where interpretive marginalization and credibility deficit come in, which the book also discusses.
Okay, break those down for me.
So interpretive marginalization, it's about how certain groups are excluded from interpreting research findings or shaping the narrative around those findings. Who gets to decide what the data means and how that meaning is shared.
Got it.
And then credibility deficit. It's about how the knowledge and expertise of certain groups is often dismissed or devalued simply because of who they are or where they come from.
So it's not just about gathering the information, it's about who controls it, who gets to interpret it, and who ultimately benefits from it.
Exactly. And these concepts highlight why it's so important to challenge those power dynamics. The ones that determine whose voices are heard, whose knowledge is valued, and ultimately whose needs are prioritized in global health.
It's about making sure that research and interventions are truly collaborative. That the people who are most affected by the issues have a seat at the table from the very beginning.
Exactly. And, both books, while they do highlight these challenges, they offer a sense of hope for a more just and equitable future for global health.
That's good to hear because honestly, all this talk about power dynamics can get a little disheartening. It makes you wonder if real change is even possible.
I get that, but both Rethinking Global Health and The Foreign Gaze, they encourage us to imagine a future where power is shared in meaningful ways,
Yeah.
where local knowledge is valued, and communities have the power to drive their own health outcomes.
So what would that kind of future look like? What are the actual steps we can take to get there?
Well, that's a question we're going to explore further in the last part of our deep dive, but one key theme that keeps coming up is this need for a fundamental shift in mindset. We need to move away from that savior complex that often shows up in global health work and embrace a more collaborative and empowering approach.
So we've covered a lot of ground,
Yeah.
talking about how we can shift those power dynamics in global health and what a more community-driven approach could really look like.
Yeah, we've been digging deep.
But I think the question on everyone's mind now is, what does this all mean for me? How can I, as someone who's obviously interested in these issues, how can I help create a more just and transformative global health landscape?
Yeah, that's the big question, isn't it?
It is a big one.
And there's no easy answer. But I think the first step, as both of these books really emphasize, is awareness. It's about understanding those complexities we've been talking about, like the influence of economics, the importance of local knowledge, the dangers of, imposing those solutions from the outside, and just being aware of these dynamics. I think that can have a huge impact on how we approach our work, whatever that work might be.
So it's about checking ourselves, questioning those assumptions, being mindful of where we fit within these power structures.
Exactly. And that self-awareness, it can lead to more conscious choices in our daily lives, and in our work.
Right.
It might mean speaking up for more equitable funding models within our organizations,
Mhm.
or amplifying the voices of those who are often marginalized in these global health conversations.
I'm also thinking about how we can use our own spheres of influence, no matter how big or small they are, to challenge those dominant narratives,
Yeah.
those ones that perpetuate harmful stereotypes or oversimplifications.
Absolutely. And it could also mean seeking out opportunities to partner with communities, in a genuine and meaningful way, making sure that they have a real voice in the decisions that affect their lives and their well-being.
One thing that really resonated with me in rethinking global health was
Hmm.
that emphasis on moving away from that savior complex
Oh, yeah.
that can sometimes, seep into global health work. It's such a subtle but powerful shift in perspective.
Yeah, it's huge. It's about recognizing that we're not there to fix communities,
Right.
but to walk alongside them, as partners working together towards better health.
And that takes humility and respect,
It
a
does.
willingness to learn from those who have different lived experiences.
Absolutely.
Which brings to mind that powerful quote from Steve Biko in Rethinking Global Health.
Mm.
If I speak, will you hear me?
Oh, yeah, that's a good one.
It's such a reminder to truly listen to those who are so often silenced or overlooked in these discussions.
Yeah, it's about making space,
Yeah,
for those voices, those perspectives to be heard and to be valued,
yeah,
because ultimately, as both of these books really drive home, the most effective and sustainable solutions are going to come from within communities themselves.
right.
Our role is to support them, amplify their voices, advocate for their needs, and challenge the systems that are creating those inequities in the first place.
And sometimes that means, pushing back against those established systems and structures, even when it feels uncomfortable or even risky.
It does, and both Rethinking Global Health and The Foreign Gaze, they encourage us to be those disruptors, challenge this status quo advocate for systemic change.
Yeah.
That might mean, pushing for more equitable research partnerships, questioning those traditional hierarchies in academia, even speaking out against harmful policies that make those health disparities
I
worse.
think it's easy to feel like those actions are small in
Yeah.
the grand scheme of things.
Yeah. Right. They can feel that way.
But both books remind us that real change, it often starts with those individual acts of courage,
Hmm.
that willingness to question the way things have always been done.
It's about planting those seeds of change,
Yeah.
knowing that those seeds can grow into something so much bigger and more impactful than we can even imagine at the start.
And that's exciting.
It is.
It's about recognizing that we're all connected,
Hmm.
and that our individual choices and actions, they can create this ripple effect of positive change in the world.
Absolutely. It's about embracing that interconnectedness and knowing that we all have a role to play in creating a more just and equitable future for global health.
So as we wrap up this deep dive, we hope you're walking away feeling empowered with a renewed sense of purpose and a commitment to using your own voice in your actions to make the world a healthier and more just place. Keep asking those tough questions, keep learning, and keep pushing for positive change.
Thanks.
Thanks for joining us.